Good evening. First of all, I'd like to thank my mother for being a part of the audience. My informative speech that I've chosen is on emergency medical services, or EMS for short. It's a really hard topic to be able to explain in a brief 3 to 6 minute video, so I'm just going to do a general overlay. First of all, EMS can be used to cover anything from paramedics, firefighters, to nurses and doctors, but the emergency medical side is more for first responders such as paramedics or firefighters. In some places, fire and EMS can be combined, but here in Berkeley County, they actually separate them into the firehouses and the Emergency Ambulance Authority. For Berkeley County, West Virginia, the fire departments are split into 5 jurisdictions where the Berkeley County Ambulance Authority controls everything that goes on in the county. And although fire companies can respond to any basic life support such as strokes or heart attacks, it's the Ambulance Authority that is called for any kind of advanced life support or for transport due to the fact that fire halls do not have ambulances inside of them. For starting off, the most basic form of EMS is an emergency provider, which is anyone who has gotten their CPR. This allows anyone to basically be able to handle a basic life support call. All firefighters are required to have your CPR before you're even able to run calls. The next level would be EMT or ENTB, which is your basic emergency medical technician. EMTs can be anywhere from 140 to 150 hours of training for the certificate, and they are allowed to be able to start IVs for basic medication, as well as administering things like nitroglycerin, which helps for blood pressure or for decreasing the chance of heart attack while on transport. They are also able to be trained to use their training to take and have childbirth, which, as what I'm interested in is to get my EMT. That's something that is beyond what I would imagine or anything that I've ever been able to do. For advanced EMT, which is a stage above, can be anywhere between 200 to 500 hours of training. Advanced EMTs are able to take and start IVs, as well as to use what's called a naropharyngeal or oropharyngeal, which is a step below intubation and allows for a better airway. What you do is you stick a tube down someone's throat or their nostril, depending upon if they have a gag reflex, in order to help circulate air better. Advanced EMTs are also trained to read heart rhythms so that they can do vitals and be able to give a more accurate report to nurses when they arrive with their patient at the hospital. And the last but not least, paramedics are the most advanced EMT provider. They're often called EMTP. As far as I know, they're the most advanced in the United States. Can't say for other countries. Paramedics are able to take and use what's called a chest needle decompression, which allows them to take and put a needle through to your lungs. What happens is that a vacuum occurs between the thoracic cavity and the lungs, deflating the lungs. They're also able to do what's called a crike, or use a crike kit. What that is basic intubation that allows them to cut incision to allow them to get airway into your body. Paramedics are anywhere between 1,000 to 1,800 hours of training, and they are the most commonly sought after in terms of emergency providing by ambulance authorities or firehouses or anyone who employs paramedics. And although EMS takes several different forms, everything goes back to that CPR or first aid that you first get as an emergency provider. And again, I'd like to thank my mother for listening to me talk briefly about EMS.